Does dietary fat make us fat? Hi, I'm Dr. Lindsay Ogle, and I'm a board-certified family medicine and obesity medicine physician. And this is a myth that has been perpetuated for quite some time. And in today's video, we're going to discuss why. So how many of you have heard that low-fat diet is important for weight loss, weight maintenance, cardiovascular health, or health in general? This has been something that, for very complicated reasons, and part of that is political reasons, has been perpetuated over the past several decades. And it is just now starting to become debunked. And I find this fascinating and also very unfortunate. So what we have found is that by emphasizing or by recommending a reduced fat diet, people have coincidentally increased their carbohydrate intake, which has perpetuated and exacerbated the incidence of type 2 diabetes and obesity, not only in this country of the United States, but throughout the world. So on the surface, it makes sense. You would think if you eat fat, then doesn't that show up as fat in and on your body? But the truth is, our bodies are much more complicated than that. We actually need fat in our diet. Fat is very important for our hormone health. It is helpful for maintaining and creating strong cell walls, which help with our skin health. It also helps provide insulation and warmth in our body. It helps protect us, gives us cushion throughout our body, and so many other functions. So fat is essential for a healthy, functioning body. So it is absolutely not something to avoid or be afraid of. One of the reasons that fat is feared is that it has more calories per gram than the other macronutrients. So the other macronutrients are protein and carbohydrates. And both protein and carbohydrates have 4 calories per gram. And fat has 9 calories per gram. So it has more than double the amount of calories in each gram of that macronutrient. So it makes fat what we call caloric dense, or have a high caloric density, meaning that in the same amount of weight of a macronutrient, there are more calories in that amount, which is important to know. If you are weighing your food and you substitute 4 grams of carbohydrates with 4 grams of fat, then you are going to get more than twice as many calories with that substitution. So that is obviously something to be aware of, but it is not the full picture. Things that make it more complicated are how our body responds to those macronutrients hormonally. And the most important hormone when it comes to our metabolic health and our weight set point and our weight management is the hormone insulin. And we hear a lot about insulin when it comes to diabetes, but insulin has many, many other functions. It's a storage hormone, so it signals our body that there is a lot of nutrients available, a lot of energy available. It's time to store that extra nutrients and energy as fat cells to be used later when maybe we don't have access to more food or energy. For weight loss, we want our insulin levels to be low. And carbohydrates are the main driver of insulin. So when you eat a carbohydrate heavy meal, especially if there's a lot of simple sugar in it or added sugar, your insulin is going to spike really high. But if you have protein, which we talked about last week, insulin levels will go up some. But if you have fat, then insulin is pretty much non-existent. Fat does not trigger insulin release. We don't need the insulin to process the fat that we take in. And a really cool trick that you can utilize to help balance your insulin levels is to incorporate fat into your foods. So if you eat items that have carbohydrates or sugar in them and you include some fat with that, your blood sugar is actually going to be more steady over time than if you had the carbohydrate or sugar alone. Eating fat helps us feel satiated and full and satisfied. Having some fat in our meals will help keep us full for longer in between meals. And so we're less likely to be snacking in between meals. You may be wondering, what's the difference between different types of fats? And this is something that is honestly a little bit controversial depending on who you ask. But for the majority of people, it is recommended to eat more unsaturated fats. And these are fats that are liquid at room temperature. So we're thinking olive oil, avocados, fish, salmon, those sorts of fats that are found in what's called the Mediterranean diet tend to be healthier for most people. It's actually the Mediterranean diet that has been the best studied for health long term. So that is something that I definitely recommend that you look into and find items that you enjoy eating and incorporate them into your diet more often. That being said, I don't want you to be 100% afraid of saturated fats. Saturated fats are something that I consume on a fairly regular basis. I'm thinking about red meats and pork and butter. These things are not necessarily bad for you. It's something that you want to eat a little bit in more moderation, but it's not something that you need to completely eliminate from your diet. For most people, again, you may want to talk to your doctor or your dietitian specifically about your case. Trans fats are one that we know are bad for everybody, and they have essentially been eliminated in America due to this known fact. I hope you learned a little bit more about fats, and I plan to talk more about this in the future. Let me know what questions you have, and of course, if you live in Missouri and would like to be my patient, I would be happy to serve you at Missouri Metabolic Health. Both links are below, and I will see you next week. Take care.